To the Indiana Attorney General's office, the number of deaths caused by prescription drug overdoses in the state has quadrupled over the past 13 years.
Now, Indiana's Medical Licensing Board is trying to help curb that problem. News 18's Elizabeth Rentschler has more on the website doctors will soon be required to use.
Dr. Ben Rockwell has been a pharmacist for 20 years and says he's seen the prescription drug addiction in our society get worse.
Opiate abuse and opiate addiction is what I'm classifying as an epidemic.
But now a new ruling by Indiana's Medical Licensing Board is trying to help stop that epidemic from getting worse by requiring all doctors to utilize the Inspect system by December 15th.
We want to make that move and that transition because not only is it good for the individual, but it's good for the economy, it's good for the workplace, it's good for families.
Inspect is the state's monitoring system which tracks what medications have been prescribed to a patient. Rockwell says it's a website he relies on every day.
There's no other way that we would know. I mean, what would I do here by myself? I don't know, who's filling what where. They could have gone over there or, so it's the only option we have.
Health Commissioner Deborah McMahon says the Medical Licensing Board voted last week to adopt the rule after state legislators required something be done.
We're one of a handful of states that do not have official prescribing rules through a medical licensing board, and I think they felt this was the time to do it, so that's when Senate Bill 246 came into fruition.
Rockwell says he couldn't be happier with the ruling, but says we still have a long journey ahead in the fight against prescription drug addiction, and that fight, he says, includes everyone.
The public needs to heighten their awareness to the opiate addiction problem. It's big and it's in this town and it's important, and we need to figure out how to deal with it.
Reporting in West Lafayette, Elizabeth Rentschler, News 18.
Deborah McMahon says not all patients will need to be put into the Inspect system. She says only those who receive prescription meds for more than 3 months qualify.